guys, I'm Maddie.
What's up guys, I'm Chase.
And today we're going to be talking to you about what an MMI is.
Let's get to it. Before we get started, please like and subscribe, and if you have any specific videos you want to see, drop those down in the comment section below and we'll be sure to get to them. Also, we're going to make another video on strategies for when you go and actually do your MMIs at interviews.
So, in case you didn't know, an MMI stands for multiple mini interviews. And this is a strategy, or I guess an alternative, that a lot of medical schools are moving towards and away from the traditional interviews where you just sit with one or two people for an extended period of time.
So what they are exactly is they're typically 5 to 10 stations that range from 5 to 10 minutes each. You will have multiple prompts and they can be all different sorts of questions.
Yeah, so it's kind of stations based, so you can kind of think of it as like speed dating a little bit. So you move from one station to the next. So you'll start outside of one room or one door and there will be a prompt outside.
Literally a piece of paper taped to the door.
Yeah, and then they'll say, okay, you can flip the piece of paper around and you read the prompt and you can take notes on it, and you usually have like a minute to max 2 minutes to read this prompt and kind of figure out what you're going to tell this interviewer. So it can be anything from, like Chase said, an ethical dilemma, like you work in a pharmacy and somebody comes in and asks you to steal life-saving medication.
Straight up a question I had. So
for their child who is
gonna die unless they get it.
Yeah, and they can't afford the medication.
Right.
So that's one thing. So then you kind of have to formulate your answer, or it could be something as simple as like, tell me about a time that you failed. It can either be a conversation or a monologue.
Right.
More often than not, it's closer to a monologue.
I agree.
They definitely, don't be surprised if they ask you like leading or clarifying questions, because that's super common, or if they try to make you change your mind. And again, we'll talk about that more in our interview or in our video about interview strategies. So make sure to check that out again. Yeah,
and I had one interviewer that literally did not say a word to me. It was the most awkward thing. Going into a room for 5 minutes, you shake your hand, you introduce, and they didn't say anything after that. They didn't even say goodbye. Like, it was so weird. But be prepared for something as strange or
like argumentative. I had somebody arguing with me. Like, it was like an argument with a stranger. It was pretty crazy.
Yeah.
So be prepared for pretty much anything.
Yeah. And then there are some schools that are starting to implement a third type of question. And I had one of these questions and it was like super weird. It was, how would you tell a patient how to brush their teeth? And it's sounds really simple, right? You know, you just explain how to brush your teeth. But imagine doing that for 5 to 10 minutes. So
and for somebody who has no idea how to brush their teeth.
Yeah. So it gets you out of your comfort zone, because obviously you're not going to be a dentist unless you're watching this preparing for a dental school MMI. But it makes you think about, you know, you're an expert. Think of yourself as a surgeon, right? How would you tell a patient how a surgery is going to go? They've never done the surgery. They have no clue about the surgery. So you got to teach them something that's so simple to you, but so complex to them, and make it understandable.
Yeah. And another important thing to note is that these people who are interviewing you aren't just necessarily people who are like permanent members of the admissions committee.
Yeah.
They can be medical students, residents, they could be physicians, nurses, PAs, or just people that they pulled out of the community. I think I had somebody who was actually a standardized patient at that medical school, and they just like joined on for fun. A
standardized patient is like a fake patient that they use to teach things on, but they're lay people. They're actually actors, so have nothing to do with medicine, but they use them in the interview process because they want to see how they can react to you and if they can relate to you.
Yeah.
So I think that's all we have. Be sure to check out the book we actually wrote and released earlier this year.
Yeah, it's linked in the description box down below.
It has chapters and chapters of all different types of interviews, strategies, anything you could want, as well as how to get into medical school and what we wish we would have known.
Yeah, for sure.
But other than that, thanks for watching.